request everyone in the room to mute themselves. Okay, just make sure your pointer is working. Yeah. So I welcome you all to another session, the Residence Corner module, where we teach neural. Please mute yourself, guys. So these sessions are arranged by the Department of Neurosurgery at Dhaka National Hospital. The idea behind these sessions is to build 3D neural anatomy, which I believe is very important for any neurosurgeon who wishes to do cranial neurosurgery. I'm previously I used to conduct this session my own, but now we have Dr. Yasser Khyber with us as well, who's an alumni of this program, and he and we have Dr. Salan, who's apparently the chief resident at Dhaka National Hospital, and will be discussing about Sylvian Fissure. Dr. Salan, please start your presentation.
Assalamu alaikum. Am I audible to all of you guys?
You are audible.
Okay, sir. Can we start? Today we are going to discuss regarding the Sylvian fissure or the lateral fissure or the main highway that could lead us to the major surgical procedures related to the base as well as to the vascular anatomy of the cranial base. So let's start from the introduction of Sylvian fissure. It is the most distinct and consistent landmark on the lateral surface of the brain. It is basically a complex fissure that carries the middle cerebral artery and its branches, and also provide a surgical gateway that is connecting the cerebral surfaces to the anterior part of the basal surface and cranial base. So if we can see in this picture, this clip or this fissure that is running from anterior and extending all the way posteriorly till the supramarginal gyrus, this is the Sylvian fissure. So in the next slides, we will be covering the different parts of the Sylvian fissure as well as the anatomy related to the Sylvian fissure. So it is not a simple longitudinal cleft. It crosses both the basal as well as the lateral cerebral surface. It has two parts, the superficial part that is visible on the front as well as the deep part that is connected to the base of basal surface. The deep part is also known as Sylvian cistern. So in this picture, a bit closer view of the Sylvian fissure in which the Sylvian dissection is done and the insula is exposed. We can see anteriorly it is the superficial part is basically further divided into stem and three rami, and the deep part is known as Sylvian cistern, in which we have the majority of the vascular supply, that is MC and its branches, the Sylvian vein. Starting from the superficial part, it contains the main stem as well as the lateral sulci. We have the three main lateral sulcus, the anterior horizontal ramus and the anterior ascending ramus. These two rami divide the frontal lobe into pars orbitalis, then pars opercularis, as well as pars triangularis. And then we have this posterior horizontal rami that is a longer. In this picture, we can see a pictorial view of this Sylvian fissure and its rami. As we can say that anteriorly, this is anterior horizontal rami, and behind it we have this ascending limb of this Sylvian fissure that is anterior ascending. Then we have this posterior horizontal rami that is extending posteriorly till the supramarginal gyrus, and posterior ramus is further divided into posterior ascending as well as the posterior descending rami. On brain surface, we will be having look at the Sylvian fissure and its rami. Anteriorly, we have this pars orbitalis, Behind this, we have this anterior horizontal rami of the Sylvian fissure. Then after this, we have this pars triangularis, and behind it, we have this pars opercularis. Between the pars triangularis and pars opercularis, we have another rami of the Sylvian fissure that is termed as the anterior ascending rami. Then we have this posterior part of the rami that is further extending posteriorly upwards into the supramarginal gyrus that is covering the posterior aspect of the Sylvian fissure. And in this picture, in which the insula is exposed, we have retracted or dissected the Sylvian fissure in order to expose the insula. We know that in the most medial part of the Sylvian fissure lead us to the insula. And anteriorly, if we retract it down, we will be facing the anterior skull base, and we will be exposing the sphenoid ridge. That is the main highway that can be used in order to assess the various sphenoid wing meningiomas as well as vascular anomalies like aneurysms and AVMs. So the deep part, we have named it as a Sylvian cistern. We can see our trajectory in the coronal plane. These are the schematic diagrams that would help us in remembering the corridor that can be entered when we are going to proceed for the skull-based surgeries. Like here we have the Sylvian fissure, and the deep part is termed as Sylvian cistern. That when opened, it lead us to another cistern that is carotid cistern, which if opened, that can further lead us to the lamina terminalis cistern. So starting from the lateral surface to the M's, if we can see the vascular anomalies of M2 or M3 aneurysms, we are starting from the lateral surface. We reach to the optical carotid recess or carotid cistern, where we can see the chiasm as well as the cellular lesions that can be accessed via this cistern routes in order to avoid the damage to the neurovascular anatomy to reach the optimum area for our surgical corridor. So in going further in detail, this is the lateral view of the brain, in which we have basically divided the Sylvian fissure into the anterior horizontal, then we have this anterior ascending, and then we have this posterior ramus of the Sylvian fissure. The stem, if we have the coronal cut of this, in which the skull base is also shown, we can see that from the anterior clinoid process, we don't have the bony window in here. So it starts medially from the anterior clinoid process, and laterally it is extending up to the sphenoid ridge between the junction of frontal and temporal lobes to the pterion. So stem start from anterior clinoid process and going laterally till the point of pterion. And here we have, we know that it has the three, Sylvian fissure has the three rami, anterior, horizontal, ascending, and posterior. So some information related to the base, stem. We know that on later images, we will be showing the anterior perforated substance, the base of skull, in which we have the demonstration of the stem as well as the superficial part of the Sylvian fissure. It is directed laterally and anteriorly between the temporal pole and the orbital gyri towards the lateral surface of brain. The Sylvian fissure stem has an important topographic relationship with the lesser wing of sphenoid bone. So when we identify the lesser wing, then we have the Sylvian fissure stem that can be seen on the lateral surface. The stem starts medially that we have talked about. Medially, its limit is the anterior sphenoid process. Laterally, we have the lesser wing of sphenoid bone up to the point of pterion. So here is the top view in which we have removed the temporal lobe and exposed the basal surface of the frontal lobe. We have these pars orbitalis, then pars triangularis, and posteriorly we have the in between we have the pars opercularis. Here we have the lateral orbital gyrus, and medially we have the posterior orbital gyrus. From medially we have the bony prominence, that is anterior clinoid process. The stem starts from here, extending laterally towards the lesser wing of sphenoid, and all this is termed as the stem. As you can see, it is labeled in here in the yellow line. So we have studied regarding the first two rami of the Sylvian Fissure that further divides the inferior frontal lobe into the pars orbitalis, triangularis, and opercularis from anterior to posterior. As we can see in this picture, we have this anterior, first is anterior horizontal rami, and then we have this anterior ascending rami. The part anterior to this is pars orbitalis, and then we have this pars triangularis, and posteriorly we have this pars opercularis. And posteriorly it is extending up to the supramarginal gyrus. Regarding the posterior ramus, it is the longest ramus that is the continuation of the Sylvian fissure. It is directed backward and upward, separating the frontal, anterior part, the frontal. Here we have the central sulcus. Anterior to this we have a whole frontal lobe, and posterior to this we have this parietal lobe. So the posterior ramus is basically separating the frontal and parietal from the temporal lobes. Its posterior end is more sharply upward and terminate in the inferior parietal. We have the superior parietal lobule, we have the inferior parietal lobule. Here we can see the posterior limb of the Sylvian fissure is extending upward and terminating into the supramarginal gyrus in the inferior parietal lobule. So regarding the deep part or deep portion of the Sylvian fissure, it is also termed as the Sylvian cistern. It has two parts: the anterior part that is sphenoidal compartment, and the posterior part that is termed as Operculoinsular compartment. In later diagrams, we will be having the division of these both parts that form the deeper part of the Sylvian fissure. This is the coronal picture of the same Sylvian fissure, in which if we can see how the access to the insula from lateral edge up to the medial border or the insula, we have the multiple structures. First, we have to dissect out the outer arachnoid membrane. Then we have the superior Sylvian vein, as well as when we first enter into the at the outer edge, we have outer arachnoid membrane. Then we have a second arachnoid membrane that is labeled as the lateral Sylvian membrane. And we have the third one that is the intermediate Sylvian membrane. And the innermost, the medialmost membrane is the medial Sylvian membrane. Medially, we have the insula. Here we have the MCA. As we can see, it is converting it into the M3 segment, and lateral on the cortical surface, we have the M4 segments of the medial. So starting from the frontal lobe here, the superficial portion of the frontal lobe is cut, and we have exposed the parts orbitalis, triangularis, and opercularis. Inferiorly, we have the Sylvian fissure that is separating the frontal lobe from the temporal lobe, as well as the parietal lobe from the temporal lobe. It is extending posteriorly uh, up to the supramarginal gyrus. Anteriorly, we have the Sylvian point. Inferiorly, we have the superior surface of the temporal lobe, in which we have the anteriormost part is temporal pole, or the anterior tip that can be labeled as the temporal pole. In the second picture, we can see that they wanted to delineate the structures that are lying in the Sylvian fissure in the top as well as in the bottom. In the top, we have the medialmost structure, the insula, and inferiorly, we have the whole temporal lobe containing the Hessel's gyrus as well as the temporal pole, and posteriorly, we will be having the planum polare, and medially we will be having the Planum Sphenoidal. So in the next picture, we have the outer cortex is removed in order to expose the white matter tracks that are connecting the different pathways within the brain. Like here we have longitudinal fasciculi 1, 2, and 3. Inferiorly, we have the planum temporal, and clearly we can see that the vessels running within the branches of MCA are running within the Sylvian fissure. It is the Sylvian point that anteriorly they have shown us the Sylvian point from where the MCA enters into the Sylvian fissure. So this here is the deep dissection at the level of basal surface, in which the temporal lobe is removed. We can see the olfactory sulcus anteriorly here, the olfactory bulb that is converting into the olfactory tract, and on either side we have these straight gyri, as well as in the midline we have the genu of the corpus callosum. So posterior to this, we have the collection of a gray matter that is termed as the anterior perforated substance that can be seen on either sides, and in the midline, we have this lamina terminalis that is lying anterior to the optic chiasm. On both sides, we can see the optic nerves that are now converting
Dr.
into the
Dr.
optic.
Arslan, please
Sir,
stick to the anatomy of Sylvian fissure.
sir, this is just to show the structures that can be covered in the medial portion of the Sylvian fissure. So yeah,
Please
we
continue.
have two compartments: the sphenoidal compartment that extends laterally from the cistern around the internal carotid artery between the frontal and temporal lobe. The roof we can um, see from this picture is formed from the posterior part of the orbital surface of frontal lobe and the anterior perforated substance. These both combine to form the roof of the sphenoidal compartment. And in the midline, we have the caudate and lentiform nuclei, as well as the anterior limb of internal capsule that are located above the roof. So the floor is formed by the anterior part of planum polare and area free of gyri on the upper temporal lobe, where is a shallow cup trench which accommodates the force of middle cerebral artery. The anterior segment of uncus and the site of amygdala is located in the medial part of the floor.
So can you go through this again one more time? Just one more time. Can you explain it to the residents, the sphenoidal compartment?
Okay, so related to the sphenoidal compartment, we have the roof and the floor. The roof is formed anteriorly by the frontal lobe that is dissected in here, and the second structure that forms it is the anterior perforated substance that can be highlighted here. And on the top of it, the portion is resected in this section. That is the basal ganglia portion, that is the caudate and the lentiform nuclei, as well as the anterior limb of the internal capsule. In any other picture, I can relate it to the medial portion. So in this picture, we have a bit clear view of the same structure. On the top of this, we can see the opercular gyri, and here we have the temporal stem. Anterior to the temporal stem, we have the anterior perforated substance. So medial part of the Sylvian fissure, the roof is formed by the anterior perforated substance as well as the operculi, frontal operculi. The roof is formed from the anterior perforated substance as well as the operculi. The Lyman insula, the prominence overlying the cingulum, is located at the lateral edge of sphenoidal compartment, and in this we have partly resected the insula as well as. So this compartment communicates medially with the Sylvian vallecula opening that basically carries the middle cerebral artery that is passing in between the Sylvian fissure of both the frontal lobes as well as the temporal lobes. So next part is operculoinsular compartment that is formed by two narrow clefts, the opercular and the insular clefts. The opercular cleft is situated where the Sylvian fissure of the frontal lobe and the parietal lobes face the Sylvian surface of the temporal lobe. So we have retracted the Sylvian surface of the frontal as well as the parietal lobes in order to expose the operculoinsular compartment. The deep part of the surface of three lobes that face each other across the opercular cleft are also oriented so that they come to face the lateral surface of the insula. We can see here we have the lateral surface of insula that has been exposed. The insular cleft has a superior limb located between the insula and the opercula. On the top of it, we can mildly delineated in this picture that we have a cleft that is separating the frontal opercula as well as the insula. And located between the insula and the insular cleft has a superior limb that is located between the insula and opercula of the frontal and parietal lobes, and an inferior limb that is located between the insula as well as the temporal operculum.
Can you go? Sorry, can you go through this again once you're done? One more, because these are the most important things when we discuss semi-fissure.
Okay. So for the operculoinsular compartment, we have two clefts. One is opercular and other is the insular cleft. The opercular cleft that is basically separating the frontal and temporal operculi from the insula. And then we have the insular cleft that is basically separating the temporal opercula from the insula. The insular cleft has two limbs, the superior limb that is located between the insula and opercula of the frontal and parietal lobe, and the inferior limb is located between the temporal operculum and the insula. So this is a sagittal section in which we can see that on the top of the section we have the frontal operculi, inferiorly we have the temporal operculi, and medially we have this Lyman insula, and in the midline we have, in the middle of this picture we have this Sylvian fissure. Regarding the clefts that are exposed in it, on the top of it we have the opercular, and on the bottom of it we have the insular cleft. And medially, we can see the anterior perforated substance. So the base related to the base of the Sylvian fissure that is formed mainly by the temporal lobe. Anteriorly, we have the Planum temporal that is free of the gyri. On the anteriormost edge, we have the temporal tip. Then we have this Planum polare. And on the top, on the lateral edge, we have the facial gyrus that form the opercular surface of the Sylvian fissure. And we have the transtemporal gyri and the Planum temporal. Here we can see the atrium of the lateral ventricle. This dissection is done from the top, in which we have removed the frontal lobes in order to expose the Sylvian surface of the temporal lobe. Medial wall, we know it's formed by the insula, and on the top of it, we have frontal operculi, and on the base, we have the temporal operculi, and the apex of the pars triangularis is slightly lateral to the anterior part of the circular sulcus and anterior limit of the basal ganglia. This is the picture that delineates the base of the the basal surface of the frontal lobe, and in which we can see that anteriorly we have the both the optic nerves. Lateral to it, we have the anterior perforated substance, and on the lateral edge, we will be seeing the in the middle, we can see the sphenoidal portion, and on the lateral, we have operculoinsular portion. Here we can see the Lyman insula. Behind it, we have the amygdala, medullary bodies in the middle, and the temporal stem posteriorly. This is the so here we can have the coronal section of the same cut, in which we can see the insula. On the lateral, we have the frontal operculum, and in medial, we have the optic tract. Lateral to it, from laterally from the optic tract up to the lateral edge of the Sylvian fissure, all area is covered basically by the Sylvian fissure along with its associated rami.
Thank you, Dr. Arslan, for this presentation. I would like Dr. Ariba to come forward, since Dr. Yasir cannot use the presentation, but can actually speak to Ariba. Can you come forward? And because Arslan did make an effort to explain the Sylvian fissure, but I think a little more clarification. Can you do that with the presentation and maybe explain just the gist of stuff? Because I think we were explaining the pictures. He was more concerned about explaining what was seen in the pictures rather than correlating the Sylvian fissure with that anatomy. Would it be possible for you to come forward, take over the system, and maybe go through our pictures, and then me, Dr. Yasir, and you can pitch in so that the resident understand what we're talking about? Not all pictures, but the important ones. Yasir, can you unmute yourself? So we all
Yes,
know
sir,
that.
I'm here.
So we all know that the Sylvian fissure is basically a gateway where you can assess the MCA, the insula. You can do it both by going through the trans-Sylvian approach, or you can take the opercular, the frontal or the temporal operculum. Okay. So Dr. Riba, yes.
Okay, sir. So Arslan explained well, but of course it was not very clear. So Arslan, would you like to explain this slide first? How the Sylvian fissure is divided into 3 parts?
everyone else mute yourself other than me, Dr. Reema, yeah,
So
and Dr.
there are
Yas.
two parts, superficial part and deep part.
The superficial part that is exposed on the lateral surface, and the medial part that is extending medial the insula.
And the deep part is further divided into two parts.
Two parts, operculoinsular. The anterior part that is the sphenoidal part, and the posterior that is operculoinsular.
So can you explain where are these three parts here?
Okay. So on the lateral surface, we can see the superficial part.
Okay.
And operculoinsular. That lies between the operculi is the anterior part, and the posterior part that is between the insula.
Okay.
And
what is sphenoidal compartment?
That lies anteriorly to the
So where do you have to go for sphenoidal compartment? You have to go somewhere laterally, or do you have to follow the corner section for that?
Corner section.
So you have to go more deeper, and then you will go for the sphenoidal compartment, which is the deepest component. Okay. Okay. So these are the parts that are of the Sylvian fissure. What are the contents of each part? What runs in the superficial part?
Yeah, superior Sylvian vein.
So can you show superior Sylvian vein here?
Here we have the superior Sylvian as well as the enforced segments of the MCM.
Okay. And what is this membrane that is dividing the superficial part from the deep part?
This is the lateral Sylvian membrane.
And how many of such membranes are there in Sylvian fissure?
Total starting from lateral to the medial surface, we have 4.
Okay. Name
the
those.
First, the outermost arachnoid membrane. The lateralmost membrane that can be named as the outermost arachnoid membrane. That forming the lateral limit of the Sylvian fissure. And once we have the Sylvian vein, then we have another membrane that is basically the lateral Sylvian membrane.
Okay. And once you remove the Sylvian membrane, where do you enter?
We will enter into the opercular portion of the Sylvian fissure. Okay.
And then what is the posterior boundary of that?
That is the intermediate Sylvian membrane.
These are the membranes that are made up of fire or arachnoid?
Arachnoid.
Okay. So once you open the intermediate Sylvian membrane, where do you enter?
We will enter into the insular portion of the Sylvian fissure.
And why it is named insular portion?
Because it is lying lateral to the insula.
Insula. Okay. And what are the contents of this compartment?
We can see the main vessel, that is MC segment.
M3 segment. Okay. And once, what is the posterior boundary of that apart from the insula?
Posterior boundary, we have this median Sylvian membrane.
And once you open it, you will enter into the
sphenoidal compartment.
Okay. And what are the structures that are present on the insula? Surface anatomy. So you have a very good picture of that here. So this is your slide about insula.
So clearly on the top we have the short gyri and the circular sulcus that is basically separating the insula from the operculum.
So circular circle is something that is limiting the insula. It's the boundary outer wall.
Outer wall.
It is present anteriorly as well as posterior. Circular circle is limiting sulcus, or the sulcus that is defining the insula. And what are different gyri that are present inside the insula?
The long gyri and as well as the short gyri.
How many long gyri and how many short gyri? Louder.
We have the 2 long gyri as well as the 3 short gyri.
3 to 5 short gyres. And what is the sulcus that is present between the long gyres and the short gyres?
I mean, his presentation was not on insula, but obviously, I think he's doing a good job.
It's the central sulcus. Again, it's the central sulcus that is communicating with the central sulcus that is present on the lateral surface. Okay. So this makes up the medial wall of the insular compartment of the Sylvian fissure. Okay. So what kind of view is this?
This is the coronal view.
Okay. So, and what parts of Sylvian fissure can we appreciate here?
From the lateral edge, we have the opercular part, and on the medial, we have the insular part.
Okay.
And in
And
the
something
midline,
else?
we have the sphenoidal part.
Sphenoidal part. Okay. And what are the medial boundary of the sphenoidal part? As you can appreciate here.
The medial boundary is formed by the carotid system.
And something else that you can see here.
Optic nerve.
And where would anterior perforator substance lie?
It forms the roof of the sphenoidal compartment.
And you have an idea what is anterior perforated substance?
It is a collection of diameter that is lying anterior to the chiasm.
Okay. Good.
So, thank you, Dr. Reba, for taking out the knowledge that he already had. I mean, obviously, he has made the effort to read and everything, but I think he got overwhelmed with the diagrams, and I think Thoda sa usme he just strayed away from. So, Yasir, do you want to add in before something before we end this session? Obviously, we want to hear from you as well.
So it was a very well explained presentation. Just one thing I would like to add is that, as you guys all explained in your own words, that Sylvian Fissure has got these two compartments. On the surface, it looks like a simple fissure, like there is any simple sulcus between two gyri. So this is only the superficial part that we are seeing, a single line. But once we start opening it, once we start dissecting it, it's a whole vast world out there. Like there's an opercular part where the two lips meet, then you go down, then you encounter the insula. So again, there's a part between those lips and the insula, that is the insular part. And then finally, once you go to the skull base, as Arslan mentioned when he was explaining it the first time, that it's the part which actually lies between the skull base and the brain overlying it. And in the medial part, as they correctly mentioned, there is this carotid, the opticocarotid recess. So the medial portion of the opticocarotid, the roof of the brain and the floor by the skull base, that is the Sylvian vallicula. So I think they have done an excellent job, sir. And maybe we can keep one presentation on the surgical approach to this insula as well, maybe by some SR of ours. And then it was a good presentation, sir.
So, is there any question from the residents sitting in the room? Any question? I know it was a little difficult. I, if there's any question from the residents sitting in the room.
Maybe, sir, if Ariba can explain the in-out technique or the out-in technique of the Sylvian Fissure.
So this is Dr. Reba's last session as an SR. So maybe if she can, before she becomes start working. So Dr. Reba, if you can, I think maybe we're short on time. Maybe next week we can do that. Or Dr. Reba, can you talk about it?
I think, sir, we will discuss it later because we are short of
Okay.
time.
Okay. Okay. I thank you. I thank you, Dr. Yasir, for joining in on such short notice. Arslan, with an excellent presentation. Obviously, you did the hard work, but I think it was just that, I would suggest that, when you choose diagrams, be very careful that it correlates with the text that you're trying to explain. I think there were some points where you got a little carried away with the diagram, but I must appreciate that the fact that you made an effort, you knew it's a difficult topic, and I would suggest everybody to go back, read about it, because every time I've listened to this presentation for maybe I've been listening to these residents for the last 6 years, but every time I listen to Sylvian Fissure, there's always something new that I'm learning. So as Dr. Yasir said that it's a small line that you see from above, but it's a whole world inside. And it is, as a surgeon who wants to do cranial neurosurgery, it's very important that you know how to dissect this and the anatomy at hand. I thank Dr. Arslan, I thank Dr. Yasir, and I wish Dr. Ariba the best of luck for our future endeavors. We'll meet you next week. Thank you all. We'd like to conclude the session here.
you, sir. I'm grateful. Thank you, Dr. Yasir, for your time and explaining the Sylvian Fissure very well.
Thank you, Dr. Sam.
Thank you, sir.
Biceps.